Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hello, and welcome back to the Friendly Pharmacist podcast. I'm Nario Cantu, your host, and today we're diving into a topic that's creating a buzz in the healthcare world. Artificial intelligence, or AI, and how it's revolutionizing healthcare and pharmacy practice. Whether it's diagnostics, treatment planning, or managing patients, artificial intelligence and machine learning are changing the way we approach healthcare. Let's start with the basics. When we talk about artificial intelligence, we're talking about the development of computer systems that can perform tasks that would normally require human intelligence. Things like visual perception, decision-making, and even language translation are part of AI's domain. But in healthcare, AI is taking on much more complex roles, and the possibilities are expanding every day. Let's first talk about artificial intelligence, or AI, in diagnostics. One of the most exciting applications of AI in healthcare is in diagnostics. Traditionally, diagnosing a condition relies on the expertise of physicians and specialists. However, AI systems are now able to analyze medical data such as imaging, lab results, and patient histories to assist doctors in making faster and more accurate diagnoses. For example, AI-powered algorithms are helping radiologists detect abnormalities in medical images, such as X-rays, MRI, and CT scans. These AI tools can identify early signs of diseases like cancer or neurological conditions with astonishing accuracy, sometimes even outperforming human specialists. This doesn't replace healthcare professionals, but it gives them a powerful tool to improve diagnostic precision and reduce the time to diagnosis. Early detection can be a game changer for patients, and artificial intelligence is at the forefront of making that a reality. Next, let's look at artificial intelligence in treatment planning. Once a diagnosis is made, the next step is treatment planning, and artificial intelligence is playing a significant role here too. Imagine having access to vast amounts of clinical data, medical literature, and patient outcomes, all at your fingertips. Artificial intelligence systems can sift through this information and generate personalized treatment recommendations for individual patients. Let's take oncology as an example. Artificial intelligence platforms can analyze a patient's genetic information, tumor characteristics, and medical history to suggest the best course of treatment. Whether it's chemotherapy, immunotherapy, or targeted drugs, artificial intelligence helps oncologists develop more personalized treatment plans tailored to the specific needs of each patient. It's like having a supercomputer collaborate with your doctor to find the most effective treatments available. In pharmacy, artificial intelligence is helping pharmacists make smarter decisions when it comes to medication management, pricing, insurance, and much more. Tools that utilize AI can flag potential drug interactions, dosing errors, or allergic reactions before prescriptions are filled. This type of artificial intelligence assistance helps pharmacists ensure patient safety and optimize the therapeutic outcomes of medications. Artificial intelligence can also be used to collect patient data in order to educate and engage patients in their treatments. Patient management is another area where AI shines. Chronic diseases like diabetes, hypertension, and asthma require ongoing monitoring and management. With AI-driven tools, healthcare providers can monitor patients' health data in real time, identify trends, and adjust treatments proactively before complications arise. For example, artificial intelligence-driven wearable devices can monitor a patient's vital signs and alert healthcare professionals when something's off. This level of continuous care allows for more timely interventions, reducing hospital visits and improving overall health outcomes. Remote patient monitoring devices can be used here to collect the data and store the information for the healthcare provider. In pharmacy, AI is also being utilized to improve patient adherence to medications. Artificial intelligence-powered apps can remind patients when to take their medications, track their adherence, and even predict when a patient might be at risk of noncompliance. This kind of proactive management can help ensure that patients are sticking to their prescribed treatment regimens, which can make a huge difference in the success of their therapy. We should be able to see an individual skipping a dose on Saturday. So by making sure the patient receives an alert on Saturday can remind him to take his medication and better adherence. What is the role of pharmacists in an AI-driven future? Now, as your pharmacist, you might wonder, where do we fit into this AI-driven future? The answer is right at the center. AI isn't here to replace pharmacists. It's here to empower us to be even better at what we do. Artificial intelligence can handle data processing and predictive analytics, but it's the pharmacist who uses that information to make clinical decisions, provide patient care, and ensure safety. For example, artificial intelligence tools can help us identify trends in prescription data, such as detecting patterns of overuse or identifying patients who are at risk of developing adverse reactions to certain drugs. Pharmacists can use this information to intervene and counsel patients, potentially preventing harmful side effects or drug interactions before they occur. Furthermore, artificial intelligence can free up time for pharmacists by automating routine tasks such as verifying prescriptions, checking for drug interactions, or managing inventory. This allows pharmacists to spend more time on what truly matters, patient care. Finally, let's focus on challenges and considerations using AI. While the potential for AI in healthcare and pharmacy is immense, it's important to recognize that there are challenges to overcome. Data privacy, for one, is a big concern. Artificial intelligence relies on vast amounts of patient data, and ensuring that this data is handled securely is crucial to maintaining patient trust. There's also the issue of accessibility. Not all healthcare providers or pharmacies have the infrastructure or resources to implement advanced AI tools. Ensuring that these technologies are accessible to all, regardless of the size or location of a practice, will be key to the widespread adoption of AI in healthcare. Finally, we can't forget the human element. Artificial intelligence is a tool, and like any tool, its effectiveness depends on how it's used. As pharmacists and healthcare professionals, we must continue to be the human touchpoint in patient care, building relationships, offering empathy, and providing personalized advice that no machine can replicate. So as we move forward into this artificial intelligence-enhanced world of healthcare, the role of your pharmacist is not diminished, it's elevated. With the support of AI and machine learning, we can offer more accurate, efficient, and personalized care to our patients, improving health outcomes across the board. The future is bright, and artificial intelligence is one of the keys to unlocking its full potential. That's all for today's episode of the Friendly Pharmacist Podcast. Thanks for tuning in, and remember, while AI is transforming healthcare, it's the compassionate, knowledgeable professionals who make the difference in patients' lives. Stay informed, stay engaged, and I'll see you next time.